What you should know about X-ray foot bones. X-ray foot bones. An X-ray of the foot takes images of the bones in your feet. They appear as black and white photographs. Dense structures, such as bone, are viewed in the white part of the image. Soft tissues, such as fat, appear in the dark portion of the image. A doctor who uses an X-ray to diagnose a foot problem will make sure that all the bones are visible. The most common problems that require an X-ray of the foot are broken bones and joint dislocations. A doctor will use this imaging method to confirm a diagnosis of general foot pain, swelling, and tenderness. Using an X-ray of the foot will help a doctor determine the cause of common foot ailments. The radiologist can use this image to determine if a foot is properly aligned and healed. A physician can also use an X-ray to plan a surgery or check the results afterward. X-rays of the feet can help diagnose cysts, tumors, and infection of the bones. X-rays of the foot are one of the most basic orthopedic investigations. Knowing what to look for is essential to identifying abnormalities in your feet. Anteroposterior views are the most common. Lateral views of the foot are also commonly used. Having the proper view will help a doctor understand the severity of any problem. A normal X-ray of the foot is a vital part of diagnosing any bone injury. An oblique X-ray is another way to view the phalanges and interphalangeal joints. In addition, it provides a second look at the calcaneus, which is an important part of the foot. The doctor can determine whether a fracture is present or not by analyzing the navicular bone with an oblique X-ray. A lateral X-ray can also be helpful in assessing a foot fracture. The X-ray of the foot is an important diagnostic tool. It allows doctors to better understand the symptoms and structure of the foot. It also helps them to determine the correct treatment. Despite the various ramifications of a fracture, these rays can provide an accurate diagnosis and a better understanding of the underlying medical condition. The oblique view is often helpful in detecting a fracture. If there is anatomical damage, a lateral X-ray will reveal it. An oblique X-ray will show the phalanges and the interphalangeal joint. The medial cuneiforms and sesamoid bones are visible on an oblique X-ray. In a normal foot, the navicular bone is seen. An oblique X-ray is also helpful in identifying fractured bones. A surgeon can better visualize a fracture by using an oblique X-ray in a patient. An oblique X-ray of the foot is important for determining whether a bone is broken or fractured. The lateral tarsals, calcaneum, and navicular bone should be examined. If the oblique X-ray shows a fracture, an oblique X-rays are useful for evaluating the foot. It is also important to analyze the navicular bone, which is usually hidden in an oblique view. An oblique X-ray can better visualize the phalanges and interphalangeal joints. The lateral tarsals and the calcaneum should be evaluated for alignment. Oblique X-rays provide a second view of the navicular bone. Hence, it is essential to understand the oblique X-ray when an oblique X-ray is performed. An oblique X-ray helps to visualize the phalanges and interphalangeal joints. During the oblique X-ray, the lateral tarsals and calcaneum should be well aligned with each other. Oblique X-rays are the best way to visualize the soft tissues of the foot. If they are not aligned, the calcaneum may need to be repositioned. Foot X-rays can be performed in emergency departments. These images can reveal abnormalities of the limbs, such as a fracture. This imaging technique also allows physicians to diagnose diseases, such as arthritis and other conditions. Lastly, a foot X-ray is a cheap and easy way to examine the bones in your feet. A radiograph is the simplest way to find a foot's bones, and it is an excellent way to diagnose a foot. Normal foot X-ray, normal foot Xray, normal foot Xray.